Hi there, I'm Kat Brown. I'm a site director of OBHG Hospitalist, and I wanted to talk to you about a very interesting case that I was a part of. It was a typical day for me in a typical hospitalist shift where you never really know what the day is going to bring, and you just start the day ready for anything. And I was just preparing to do rounds when a nurse grabbed me and told me the emergency room had called and they needed me right away. So I just dropped what I was doing. I think I even left my computer logged in because I ran so quickly down to the emergency room. And one of the other physicians had seen me running and so came shortly after me as well. But when I arrived into the emergency room in the trauma bay, I saw them doing CPR actively on a patient that was very visibly pregnant, like third trimester pregnant. We didn't know whose patient it was. I didn't know any backstory. So when I entered the room really quickly, I quickly asked the emergency room doctor to just give me a quick rundown of what had happened. They had already put a tube down her throat to breathe for her. They were doing chest compressions to keep her heart beating at that point. And he told me that she had showed up feeling shortness of breath, and her vital signs were normal, but they thought she was having an anxiety attack. But about a little over 10 minutes after she arrived, suddenly she did stop breathing, and they had to begin CPR for her. So at that point, I quickly tried to get the baby's heartbeat to see if we could assess what baby was doing, and we weren't able to assess the heart rate just because of the CPR on mom. So at that point, I needed to make the decision right away that we needed to do an emergency C-section right there on the ER gurney in the trauma bay, despite not having any operative equipment or drapes or anything available. The ER staff scrambled to get me what I needed and asked for a scalpel. And we cleaned mom's abdomen with a cleansing solution as quickly as we could. And at that point, did the C-section as rapidly as we could. I think we got the baby out within 30 seconds of getting the scalpel. Baby initially delivered and did not show any signs of life, no breathing efforts, no good color or tone. But we clamped the cord and gave the baby right away to one of my labor and delivery nurses who had ran down as well. And she and a respiratory therapist were able to resuscitate this baby right at the warmer, and baby began crying and came around. So we finished the surgery, we finished the cesarean section and closed the uterus, closed mom's abdominal wall as best we could. And shortly after we were closing skin and just finishing the procedure itself, they were still doing CPR, but one of the ER physicians yelled out, "We got a pulse." So the entire time from the time I entered the room, they were pushing so many life-saving medications and doing CPR. But the whole time, mom really physically looked like she was dead. I mean, her skin was dusky. But when they yelled out that she got a pulse back, everyone had this sigh of relief. They were able to get her heart beating spontaneously on its own from all their life-saving measures. And ultimately, they stabilized her and took her to the intensive care unit. The baby went to the NICU just because of being 36 weeks, but ultimately had no deficits and had no issues, no signs of any brain damage or any lack of oxygen. And about 3 days after this event took place, when I returned for another shift as a hospitalist, I went to round on the patient and she was extubated, and we finally got to talk and talk about what had happened that day. But ultimately, she made a full recovery, left the hospital without any long-term deficits, and both she and her baby are doing well, and both survived the ordeal. So an amazing thing that has happened. Many times when patients require what we consider to be a perimortem C-section, or a C-section that's done when a mom is on the verge of death to save the baby, most situations like that, you might lose one of the two patients. Sometimes both don't survive, and sometimes babies have a significant, sequelae from having been exposed to that. And it was a very miraculous thing that both of these patients, both mom and baby, did well and are doing well and are healthy now after this happened. So, the interesting part of this was that I didn't know anything about this patient. We didn't know who her OB doctor was, but had an OB hospitalist not been on duty and readily available to run to this emergency, I don't know if we would have had the same outcome. So I think that, I feel really proud of what I do for OBHG, and I feel like our presence in hospitals really elevates the quality of care that we can provide patients and really enhances the safety to all obstetrical patients.